Welcome back to the Road Conference. We are now going to begin our second session, which is a panel discussion with the San Joaquin Valley Program in Medical Education, also known as the SJV PRIME Program. This is a really special session because we hear faculty and students who are actually in the program. I'm going to stop sharing my screen as I do this, so that you'll be able to see and meet our panelists. So to start, I'd like to introduce you to Dr. Loren Alving. Dr. Alving is the Health Sciences Clinical Professor of Neurology and the Director of the UCSF Fresno Alzheimer and Memory Center. She is the Director of the SJV PRIME Program and a member of the Academy of Medical Educators. Thank you for being here with us, Dr. Alving. I'd like to now introduce the medical student panelists, starting with Jacqueline Leon. She's a third-year medical student in the SJV PRIME program at UC Davis School of Medicine. She was born in Fresno and raised in various parts throughout Fresno and Tulare County. She is a proud descendant of Mexican immigrants, many of whom are agricultural farm workers and small business owners. Her motivation in becoming a doctor is the synergy between public health, medicine, health leadership, teaching, and mentorship. Jacqueline plans to return to the Central Valley as a family physician to serve as an agent for social change and as a physician champion, activist, and ally for underrepresented and disenfranchised communities. Thank you for being here, Jacqueline.
Good morning.
I'd like to now introduce Jeffrey Rilveria, who grew up in Delano, California, and he studied cell and molecular biology at San Diego State University. His journey to medical school has been all but traditional. After he completed his degree, he worked as an environmental chemist for several years before realizing he wanted to be at the forefront of addressing the physician shortage in the Central Valley. Inspired, Jeff then completed the UC Davis Post-Baccalaureate program, which propelled him to where he is now as a third-year medical SJV PRIME student at the UC Davis School of Medicine. In his spare time, he likes to hang out with his hamsters and dance. Thank you, Jeffrey, for being here.
Thank you. Good morning.
I'd like to now introduce Ray Berry. She's a second-year medical student at UCSF in the SJV PRIME program. She grew up in Ceres, California, and an area with high poverty rates and uninsured residents. She witnessed her own family suffering from these socioeconomic factors. Her mother was an immigrant from Israel, and her father suffered from an illness, leaving her family in poverty for much of her childhood. She attended undergrad at Fresno State and spent much of her free time working as a scribe and peer mentor teacher, contributing to her passion for her Central Valley community as both a future healthcare leader, educator, and mentor. Ray, thank you so much for being here with us today. Next, I'd like to introduce Vanessa Mora. She was born and raised in Fowler, California, a small farm town in the Central Valley. She is the daughter of 2 Mexican immigrants and the second in her family to pursue higher education. In 2015, she earned her Bachelor of Sciences degree in Biological Sciences from UC Santa Barbara. And after graduating, Vanessa then was involved in clinical work in community outreach, mentorship of underrepresented minority students. And most recently, Vanessa has worked as a clinical research coordinator assistant for UCSF at San Francisco's General Hospital. In her free time, she enjoys reading, walking her dog Maverick, and visiting loved ones. She's really passionate about working with the underserved and is looking forward to returning to the Central Valley to address the health inequities. Thank you, Vanessa, for being here. And finally, I'd like to introduce Jacob Perez-Stringer. He is a small rural town boy who was told he didn't have a grade to become a nurse when enrolling to the local community college. Jacob developed a passion for science in college, and now he's here as a medical doctor candidate at UCSF. He loves animals and tries to spend a lot of his time outdoors being active. He also enjoys interacting with people, and he rarely takes himself seriously and plays sports whenever and wherever he can. Thank you, Jacob, for being here as well. So I'm going to introduce my colleague, Paula Peterson, who will be moderating the panel discussion and taking it from here. So Paula?
And thank you so much, Dr. Phillips. For this session, we will have Dr. Alving and Rilveria presenting, and then I will lead a period of moderated questions for our panel. After that, we will have a period of time where the audience members can ask questions. So please take the time to add any questions to the Q&A, and we will get through as many as we can with our panel. So without further ado, I'm going to go ahead and hand it off to Dr. Alving to get us started. Thank you.
All right, thank you very much. And we have a few slides to show. And what we're going to do is speak a little bit about what SJV PRIME is. And you can see on your screen, San Joaquin Valley PRIME, which is Programs in Medical Education, is a program for medical students from and dedicated to coming back to the Central Valley. And it's a rather unique partnership among several UC institutions, UCSF, UCSF Fresno, UC Merced, and UC Davis. And you can see several of our, representatives from several of our classes here. You can see at the bottom left, some of the current third-year students who are actually UC Davis students. You can see at the top right, our inaugural UCSF class, and at the bottom, you can see the members of our second UCSF class. So rather unique in PRIME programs because it spans 3 different UC schools. Moving on, you can see the next slide. For those of you who are not aware of what the Central Valley is, it's not exactly the same as the San Joaquin Valley. The San Joaquin Valley is a specific part of the Central Valley from San Joaquin County in the north, near the Stockton area, all the way through Kern County in the south. And given that we span 3 campuses, it's important to realize that going from UCSF Fresno to UCSF main campus is about 4 hours, okay? It depends on how one is driving. Going from Fresno to Merced also takes about an hour, hour and a half each way. So our campus, the regional branch campus, does span a rather significant portion of the valley. Now I'm going to turn it over to Ray to tell you a little bit more about the program and why we need it.
All right, hi everyone. Thank you, Dr. Alving. So what is SJV PRIME? So SJV PRIME is a tailored track for medical students who are committed to ensuring high quality, diverse, and equitable care to communities and individuals in the San Joaquin Valley. It is a track at UCSF School of Medicine that incorporates the expertise of UCSF, UC Merced, and UCSF Fresno faculty, researchers, educators, and leaders. SJV PRIME is a 4-year program where the first 18 months are spent at the UCSF main campus in San Francisco, and the other 2.5 years of clinicals are spent in Fresno. SJV PRIME allows medical students to train and gain the knowledge and tools to better serve and improve health for populations, communities, and individuals in California's San Joaquin Valley. Now I'm going to turn it back over to Dr. Alving to talk about the mission statement.
Thank you, Ray. Our mission statement is one of the most important things about our program. Our mission is to develop the future physicians that not only will serve the San Joaquin Valley, but will be healthcare leaders, and their impact will be far beyond their numbers. So we plan to do that by recruiting students from and educating them within the Valley. We also think it's extremely important that they learn to work effectively with our community partners, because that's the best way to impact the health disparities and the needs of our population. And we are looking to get a dedicated, diverse, and committed group that will serve these underserved populations. And I'm going to turn it back to Ray to tell you why it is we really need such physicians badly.
All right, so now the next couple slides are gonna be just like a discussion of the importance of like why we have SJV Prime. And one of the reasons is because the San Joaquin Valley is one of the fastest growing, poorest, and least healthy regions of California. It unfortunately lags behind much of the state in many socioeconomic and environmental indicators, with some of the poorest rates of like air quality and highest rates of poverty and uninsured in the state and nation. There are more than 4 million people that live in the San Joaquin Valley, and approximately 41% of the population is covered by Medi-Cal. And also, one thing I found very striking is there are 58 counties in California, and Fresno, Kern, Madera, and Tulare counties actually rank 52nd, 53rd, 49th, and 50th for health outcomes. And another reason why SJV Prime is so important is because we have a severe shortage of physicians and other healthcare professionals in the Valley. So orienting you to this graph, this y-axis is the number of physicians per 100,000 people. And on the x-axis are different counties in California, including San Joaquin Valley, Inland Empire, LA, Greater Bay Area, as well as California as a whole. We're going to really focus our attention on this purple star, which represents the San Joaquin Valley. And that shows that the San Joaquin Valley has some of the lowest number of physicians per 100,000 people when compared to LA, the Greater Bay Area, and California as a whole. And we can also see that the Inland Empire struggles similar to us with physician shortages. Now in the San Joaquin Valley, we have a total of 5,600 physicians. 30% or 1,680 of those are over the age of 60, and only 14% or 784 of those are under 40. And if every year 10% of those physicians over the age of 60 are like lost to retirement, to illness, or for really any other reason, that means we will lose 168 physicians each year. And I'm going to turn it back over to Dr. Alving to talk about the San Joaquin 6.
Great, thanks, Ray. This is one of my favorite topics, the San Joaquin 6. UCSF School of Medicine has a few areas of concentration that they base their curriculum around, and they are called the UCSF 49. And for those of you sports fans out there, this is not 49 after the 49ers, but it's 49 because it refers to the square mileage of San Francisco. And they've picked these out for as areas of focus for their students. So all of the students at UCSF, be they UCSF Maine or SJV Prime, will study all of these. We decided that for our program, we would have an additional 6, the San Joaquin 6, picked for their alliterative features, that focus on the pertinent health issues in the San Joaquin Valley. So we picked the areas that we felt were extremely important, including immigrant health and diabetes, which is really a cheating way of getting 2 for 1, diabetes and obesity. Coccidiomycosis, which is otherwise known as valley fever. Human trafficking, which is a huge issue in the San Joaquin Valley. Preterm birth and methamphetamine use disorder. Now we know that there are many other issues that face the Central Valley, but we think that we have picked a diverse selection of extremely important issues, and we focus on these in our curriculum. I'm going to hand it back to Ray for the rest of this presentation.
Awesome. Thank you, Dr. Alving. All right, so going into the requirements to apply, everything that I'm going to say is on UCSF's admissions website. And I just want to say that I'm not permitted or qualified to further discuss questions related to admissions, but there is a session being held later this afternoon by the UCSF admissions team. So definitely if you have questions related to admissions, make sure you attend that session. So the courses required for UCSF at a minimum include 1 year of biology, 1 year of chemistry, 1 biochemistry course, and 1 physics course. Now, these course requirements make up the basic foundation for all applicants, but most successful applicants will have gone beyond the ones I've listed here. Most successful applicants will have taken at least like one upper division biology course like immunology or genetics, as well as a full year of organic chemistry. And then also UCSF really values performance in humanities and the ability to communicate in a language commonly used by non-English speaking populations in the United States. Now, another thing that's important is the MCAT. So if you've taken the MCAT more than once, the UCSF will look at the most recent score that you've submitted. And then the MCAT must have been taken within the 3 years of entering medical school. So for example, if you're applying in 2021, they'll accept scores from 2019, 2020, and up until September 2021. And then another thing that they look at is academic performance. Now UCSF will evaluate academic performance in the context of like many different factors, and applicants who have non-traditional backgrounds should not be discouraged in applying. One important thing to mention though is that students should not select courses for like the sole purpose of raising their GPA. Now I'm going to dive into some misconceptions about PRIME. So for one, a lot of people think that PRIME is primary care, and that is actually false. So you actually could become any kind of doctor in the San Joaquin Valley PRIME program. We like you saw in the previous graph is that we have a shortage of physicians, and we have a shortage of all physicians in the Central Valley or San Joaquin Valley. Also, another misconception is that anyone can join SJV PRIME, but you actually have to have ties to the Valley, and you have to be committed to the Valley in order to qualify to be a part of SJV PRIME. Something I hear a lot of people say is like, I'm interested in PRIME, but I won't get into UCSF with a B or C on my transcript. I wanted to say that, you know, like 1B or 1C won't be the end of your medical school dream. And I actually have classmates with me currently that have had, you know, a B or C in their transcripts, and they're at UCSF with me. Another thing I hear is if I did not scribe or do research, then I will not be good enough to get into medical school or SJV PRIME. And I wanted to let you know that there is not one particular set of extracurriculars that will get you into medical school. You know, a lot of times you think of like this medical school applicant as someone who did a lot of scribing, a lot of research, but there's not one particular set of activities that will like get you into medical school. So really focusing on your drives and your passions, and then making sure that in those extracurricular activities that you do, you're showing some dedication to medicine. So now some opportunities for getting involved in the Central Valley. Most of these opportunities will be specific like to the Fresno area, but a lot of these will also span outside of Fresno. One of those is a scribe. So for anyone who doesn't know what a scribe is, they're like a personal assistant to the clinician or physician. They document the physician's patient encounter in the electronic health record, and their main role is to improve physician productivity and improve patient care by allowing the physician or clinician to really focus on medical decision making. Now, there's different scribe programs like in the Central Valley. One of them is through Vituity, which is really like an organization that contracts with hospitals, and they'll contract with hospitals and give physicians to them, or they'll also give scribes if the physicians want to use them. Also, there's one called Scribe America that's used in the Valley too. And then at CRMC in Fresno, they have their own scribe program as well, which I think at least one of our panelists was a member of. Another way to be involved is through the Mobile Heal Clinic. And the Mobile Heal Clinic provides no-cost medical care to underserved populations, including populations that are experiencing homelessness, migrant farm workers, rural communities, and at-risk youth. And it's a really good opportunity for pre-health students to gain clinical experience in order to be successful applicants to the health professional schools. Another way to get involved that I personally did was through Hines Hospice. Now, hospice is available like throughout California and throughout the US in general. But Hines Hospice is specifically in Fresno, and it's an organization that provides end-of-life care to individuals who have a diagnosis that gives them 6 months or less to live. And there are a couple of ways to volunteer with this organization. One way that I volunteered is as a patient companion, where I was actually given a patient where I would spend time with them. So for about once every week, I would spend, 1 to 2 hours with the patient that I was assigned. And we would, I would go to their assisted living facility and I would play checkers with them. Like he even taught me how to do like some waltz dancing. So, it's just a really good way to connect with people who are at the end of their life, and might be lonely and want some human interaction. Another way to get involved is through Tsuchi Clinic. And that actually spans across California. And it also offers mobile clinic services, including like vision care, dental care, and medical services. And then 2 ways to be involved, especially like now during COVID, because I know that's really a difficult thing to do, is it's hard to get some clinical experience when people are limiting the amount of people going into like the hospital or seeing patients. So one way that I actually was a little bit involved when COVID first started, because I all of a sudden now had all this free time, was in shelters for individuals experiencing homelessness. So a lot of the people who will volunteer for those shelters are older people, and because they became more at risk with COVID, there was a lot of need for helping in the shelters. And so, whether it's like through the kitchen or other means, they're usually very open to having volunteers. And then the other one I want to mention was tutoring. So there's like, as we know, there's all of us are on Zoom right now. And as for like me and a couple of the other panelists that are still doing, like the medical school didactics, we are on Zoom as well. And there's a lot of kids throughout the Central Valley, especially because schools haven't opened, who are learning over Zoom. And some of those kids might have parents who can't be home with them because they're working, or they might have parents who aren't English speaking, so they're not able to help with their homework. So getting involved in like helping, tutoring, and helping those kids is a really good way to spend any free time you might have right now. And that is all I have for the presentation. So I was going to just leave it open to questions now.
Thank you so much, Ray. We actually have now this time in our session, we actually have some predetermined questions for the panelists that we would like to go ahead and put out there. So I believe we're working on getting all of the panelists on the screen so the entire audience can see all of you as you answer the questions.
Should I stop sharing my screen?
Yes, please.
Yes, I believe so. Awesome. So I know that we've already done bios, but we would like to ask each of the panelists just one more time if you would just state your name, maybe remind the audience which medical school you are attending, where you're currently located, and most importantly, why did you choose SJV PRIME?
Does it matter who goes first?
It does not.
Okay, I guess I'm talking, so I'll go ahead and start with that. So hello, my name is Jacqueline. I'm a third-year medical student with the SJV PRIME program, and I attend the School of UC Davis School of Medicine. So we're the last cohort, and the next set of students that you'll be listening to are part of the UCSF main campus SJV PRIME program. I'm currently situated in Fresno. Fresno is a town that I was born and raised, but as you probably heard from my bio, I moved around a lot as a kid. So I like to say I'm a homegrown kid from Tulare and Fresno County. Let's see, and then why did I apply to SJV PRIME? It was imperative for me to be part of SJV PRIME as a medical student. So a little bit about myself, I'm a non-traditional student. I had a career in public health before going to medical school. And so I kind of started the whole pre-med track kind of thinking I knew I wanted to be a doctor, but never interfaced with the healthcare system myself. I grew up in an era where it was pre-Obamacare, so I never got healthcare services. The way I was raised, I never went to the doctor unless you were absolutely like dying on your deathbed, then you would go see the doctor. So for me, I never really, I had a kind of idealized concept of what being a doctor was, but I never really saw one in action. And so for me, I really, really gravitated towards the reasons why people are sick. Why do people have certain, resources in their neighborhoods? Why do people practice certain health behaviors. So for me, that's why I pursued a career in public health for many years. And that bug of being a doctor just never left. And I was working at a hospital in Porterville. I had moved back after being gone from the Central Valley for about 13, 14 years. And it was then that kind of re-motivated me to be to finish my dream of being a doctor. At the hospital that I was working at, there was not a month or a week that wouldn't go by that I wouldn't see a family member coming through our doors. The reason why I say this is because having had, gone through undergrad, master's program, post-bac program, which I can speak a little bit about, there's a difference when you're going through medical school. Medical school is hard. You want to have your why nearby in terms of like, why are you doing all of this? And so I knew that at that moment, if I was going to enroll into medical school, I wanted to learn medicine in my own backyard. I wanted to be in the hospital where I was born at. And I can speak a little bit about my clinical experience, but right now I'm in OBGYN, and it's kind of full circle to be able to practice medicine in the same hospital I was born at. So anyways, don't regret it. I love coming back home. And I love being part of the SJV PRIME program and be around people who are from the same region that are just as excited, which is very weird because I think many of you who probably have gone to school outside of the Valley, nobody really has a clue of who we are or where we are. So it's really nice to actually be able to be among colleagues who are just as motivated and passionate and determined to really make a difference within our region. So I think I spoke a little bit too much, so I'll go ahead and pass on the microphone to somebody else.
Thanks, Jacqueline. Next.
I guess I can go next. Hi, everyone. My name is Vanessa Mora. I was born and raised also in the Valley, so I'm from a small farm town called Fowler in Fresno County. I am the daughter of 2 Mexican immigrants who moved here long before I was born. But similar to Jacqueline, my whole goal of going to medical school was to go back to the Valley and to make a difference there based on all the disadvantages that I saw growing up. I also had Medi-Cal, and because my parents were farm workers, they were uninsured and low income. So they were exposed to a lot of health inequities, and they, similarly, they didn't go to the doctor unless somebody was dying. So having seen that, I wanted to be at the forefront of that change as well. So becoming part of SJV PRIME was just kind of the perfect situation for me. And it is really inspiring to be amongst a group of individuals that are equally passionate about this region, and that, they're very mission driven. And I think that's really special to be part of something bigger.
Thank you, Vanessa. Next person.
I guess I can go. So for me, my route to medicine was a little bit weird. I wanted to become a nurse. Coming out of high school, I had pretty bad grades. My counselor told me I basically shouldn't try to do that. So long story short, I tried to become a nurse, and then I tried to become a PA, and I ended up becoming a scribe at CRMC, and had great exposure there. Decided I wanted to shoot for an MD, and I definitely know that I wanted to return to the Valley. I have all my family and friends there, so there was no question for me that I was going to return to the Valley. It's very underserved, and the fact that we can learn more specific, I guess, details and or treatments for the populations in the Valley in the SJV PRIME program, I thought that was great. And we get to come back to Fresno, which is just like icing on the cake. So it just, SJV fit perfectly for me. Yeah, and I think a lot of people that live in the San Joaquin Valley do want to return. There's actually a really high retention rate. This is a great program for you. Serve our underserved communities. I also had my own issues with the healthcare system. I lived with a single mother who's a part-time PE teacher, and yeah, without going into details, we had our own issues with the healthcare system. So to try and combat those as a physician is actually going to be pretty awesome. So yeah, thank you.
Thank you so much, Jacob. Jeffrey or Ray, I think you were the last two.
Yeah, I can go ahead and go. So again, my name is Rilveria. I'm going to keep this brief because I know I talked a lot in the presentation. I'm a second-year medical student at UCSF School of Medicine, and currently I'm in Modesto, California, which is near where I was born and raised. I was born in Ceres, California, which is like a really small town next to Modesto. And really like why I chose SJV Prime, very similar to Jacob, like I always wanted to come back. I knew I would want to come back to the Valley. We've had now like 4 generations of my family in the Valley. My grandpa was like a farm worker. He did like a lot of work on fish farms, and my mom immigrated here from Israel. And at that time, she had a lot of difficulty, you know, just like finding a job. She's actually got her nursing degree in Israel and then came here, and she couldn't even work as she took her RN boards and passed, but she couldn't even work as an RN because she didn't know English well enough. So she actually worked as like an LVN with an RN license for many years, trying to learn English. And really, I feel like the Valley gave her those opportunities. I feel like if she was anywhere else, she wouldn't have been able to thrive as well. And you know, my father struggled with a lot of mental health issues that left us that left my mom like the primary breadwinner of our family. And you know, I feel like being in the Valley, we were able to survive that. Like if we were anywhere else in California, I don't think we would have survived that. Now there was like difficulties for sure. My dad didn't get the access that he needed to his mental health care for a long time. Like mental health care in the Valley is we have a severe shortage of mental health providers here. And, you know, even now a lot of what mental health services are given are through like telehealth. So there's continues to be a severe shortage. But really like just being here, I feel like or in the Valley in general, I feel like that's home for me. And when I worked as a scribe in Fresno, I really got to see and like witness the disparities that exist in the Valley. For example, you know, there would be some people would come in for like an earache, and they came into the ER and waited 10 hours due to the fact that they didn't have a primary care doctor, or they couldn't get in to see one for 3 months. And, you know, even me, when I've been like very fortunate that since my mom's a nurse, like I've never had to struggle with healthcare. But even having insurance, I remember I hurt my ankle during playing basketball, and it hurt a lot to work on it. And I asked my doctor for an appointment. They said, yeah, we can get you in 3 months. And I was like, well, my ankle hurts now. Like, how can I wait 3 months? And so, you know, just through those experiences, I really got to see a lot of the how underserved the Valley is. And that's pretty much like why I want to come back.
Thank you so much. That leaves Jeff left.
Yeah. Good morning, everyone. Yeah, so my name is Jeff Rilveria. I'm currently here in Fresno on my as a 3rd year on my surgery rotation. Actually, I was studying right before this. But yeah, so I'm with Jackie. I'm part of the UC Davis School of Medicine cohort, the last cohort here from UC Davis, at least. So yeah, still here, currently here in Fresno. And then why I chose Prime, a little bit about myself. So I'm the first child from two Filipino immigrants that came here looking for a better life. And then, so I grew up in a household that was primarily, that was really impoverished in terms of just like being field workers. And so similar to some of my colleagues here, the idea of medicine wasn't really that you know, as a, I guess it's not something that like we really like had. What really stuck out like when I was a kid and why I chose medicine was when my uncle was when I was 8, my uncle got sick with like leukemia, and I didn't really understand that. And being the primary like translator in the family, growing up and being educated and being the only person that could really like speak through English, I was the one that translated it. And so that stuck with me, and not really understanding how like the healthcare system worked, being exposed to that when I was younger, I kind of like that stuck with me. And so being from Delano, down south in the Kern County, seeing all these numbers, it makes sense. Like it was not something that we really like learned about or really exposed about. So going through my career, being the first person in my family to go off to college and then pursue a career in medicine, I really want to be able to go back to Delano, to the Bakersfield and Delano area, to like really make an impact, to help with the medical education or health literacy overall, to get people to understand, like in the primary care setting and further on, like my idea of like my whole goal in the future is to become an IM doc or a hospital internal medicine doctor as a hospitalist as of right now, but to be able to make that impact for people that look like us, and get them to seek the care out sooner and understand like all the things that go into health in general. So yeah, thank you.
Thank you so much for sharing, and for everybody just kind of giving a little bit more insight to why you chose SJV Prime. Now we're going to lead into a handful of questions that are going to be open to any of the panelists to answer. So if we can just get at least one, if not a few more that would like to answer each of these questions, and we'll move through them and then open it to the audience members to also ask additional questions. So number 2, what did you do to prepare for the MCAT? And what do you recommend for those who are studying now or will be studying soon?
I guess I could touch a little bit on this. So I didn't go into a lot of detail about my journey, but I took the MCAT a total of 4 times before I was accepted to medical school. I applied a total of 3 times to medical school, so it's kind of been a long journey for me. And a lot of that struggle was taking the MCAT. Like I had a really hard time with test anxiety and a really hard time with standardized tests in general. So I think like over time, one thing that really changed was just doing a lot of practice. Like the 4th time that I took it, my score went up a lot higher. And the only thing that really changed is that I focused all of my studying on practice. So I would do practice problems, and based on the problems that I would get wrong, I would do all of my review on that. So it went from being a lot of like passive reading of like MCAT books to being really, active, like actively learning from the questions that I was getting wrong. So in terms of like resources, I really used UWorld. I used all the AAMC materials. And then for tests, it's something called Blueprint now. I think it's Blueprint, but it used to be called something else. But that's where I got my full-length exams.
Thank you, Vanessa. Would anyone else like to also answer?
Yeah, I can. So I also was somebody who struggled with the MCAT. I first took the MCAT when it was the old one, and then kind of took a couple years off and took it again. So I think my struggle was really more of the mental aspect of what this MCAT does to you. And the reason why I speak to this is because I realize that I'm the type of person that whatever I have in my head, my attitude or thoughts about a subject, it really affects my performance. And so, as a pre-med, we always kind of think about, well, if I don't get this score, I'm not going to get in. It's kind of like you pedestal this exam. And that's what I did as a pre-med, and it really impacted my score. I would say for those of you who are struggling to take it again and again and again, you really need to think about when is the best time for you to take it. And for me, I always try to do it like every summer afterwards, and I just burnt out. And every summer I had no life. I mean, you're out of school sometimes if you're not doing summer school, and everyone's enjoying the world and you're not. And, you know, I would do this MCAT boot camping like at least 3 times, 4 times, not showing up for the exams. I didn't score well enough. So I think the biggest thing for me that really changed it for me was I think I had like a 2 or 3 year break from the old MCAT to the new one. So that really helped in terms of like, okay, let me just kind of like break away from MCAT for a moment, just really focus on myself and just really understand like the why behind medicine, which is kind of part of why I continued my career in public health. That was extremely helpful for me. And I know that many of you out there are probably struggling with MCAT, so maybe kind of do like a self analysis in terms of like, okay, is this really a good time for me to still do this? Should I take a little break? The other thing that really helped me the last time around was just really being grateful to take the MCAT, which is, I know, very, very opposite of like, what the freaking F, like this is like the worst thing in the world for me to do for the like nth time. But I think for me, once I entered the MCAT space in a place of like graciousness and just privilege, that's when I really saw that my score was different. So, you know, I'm a descendant of immigrants, you know, both of them from Mexico, you know, like a lot of my family work in the fields to this day. So for me, I really thought about, wow, you know, like I am going to be the first in my family to even have a chance to be a doctor, you know? So I think once I kind of entered that mind space of just like, you know, I made it this far, you know, like how many of my friends who pursued that pre-med path that, you know, didn't even pass or go through OChem, you know, I did. I graduated from freaking UC Berkeley, you know, with a degree. Like that's an achievement in itself, like let alone college. So I think once I kind of entered that space of just like, you know what, Jackie, you did good, you know, and this is a test that sucks. But once I kind of didn't pedestal and I wasn't scared, and I was just like, okay, MCAT, I'm happy to be sitting down today. You know, I think that was kind of what helped me to finally get in with the most recent MCAT.
I can, I'll share just a little something. I really wanted to bump what Vanessa also said about this whole idea of like passive studying. So a lot of what the like programs that like are like trying to help you study for the MCAT do is they just give you these books to like read and to take notes on and to highlight. But this idea of like passive study is kind of what we tend to go through like our whole lives, in just as like in elementary school, in junior high, high school, and even in college. It's a lot of like textbook reading, and you know, whenever you go to study for the MCAT though, like if you just take these books and read them, you've been reading them, you've been doing that in undergrad, you know. So really taking the time to actively study. By one great tool is like Vanessa said, practice tests. Also, you know, like actively engaging with information in the sense of like, let's say you get a question wrong and you're not understanding a concept in genetics. Well, like instead of going to a textbook and reading about the genetics, maybe like actively searching for videos, for, you know, websites, just something to like engage yourself and actively be doing. I think that's the best way to study for the MCAT. And also like having a schedule. What helped me a lot was I took like 5 months to study for the MCAT, and that's because I was working full time while doing that. And 5 months seems like a really long time to study for the MCAT, but you know, life gets to all of us. We work, some of us work full time, some of us are taking care of our younger siblings, you know, family members. We might be caretakers for our parents or our grandparents. You know, there's a lot of things that happen in our lives, and 5 months can just fly by so quickly. So really having a schedule that you can look at and hold yourself accountable to will help you. And then if you're not meeting those weekly goals or those monthly goals, then you can start to think about like, okay, what do I maybe need to change or you know, to spend less time doing something in order to focus on this MCAT because I'm falling behind. Or maybe I need to postpone when I'm taking the MCAT because I'm not meeting the goals I need to meet. So scheduling is really important. And lastly, I wanted to mention, I forgot to mention this in the presentation, but through the MCAT's different this year. For UCSF, they are not they're not making decisions on whether to send you a secondary application or whether to grant you an interview based off of your MCATs, based off of having an MCAT. So you can not have taken the MCAT yet and still get a secondary and still get an interview at UCSF. But when you do get admitted, by then you'll have to have an MCAT.
Thank you so much for all of those answers. We're going to go ahead and move on to the next question and ask the panelists, what type of extracurriculars did you do throughout college to help strengthen your medical school application?
I guess I can start with this one. So I did my undergrad at San Diego State, and I think that the biggest thing to strengthen your resume or to get into med school is just do something that you love. Obviously, you want to demonstrate your passion for medicine. I did, like AMSA kind of stuff as well for medical, but I rode in college. So what that means is like being on a boat with like 8 or 7 other people, and then just rode like on the ocean or in the water. And so that was something that, like, whatever you do something that you're passionate about. It's something that you can talk about and not just have something just there as a filler. I feel like that makes you stand out more than just like this laundry list of like things that, in terms of just research. Those things are great to have, but I mean, it's hard to talk about those things if you just like were there for maybe like 1 or 2 weeks or however long. I did a lot of I did the post-bac at UC Davis, which is like the 1-year post-bac. And while there, I did go through the motions in terms of just doing great in, during the year to demonstrate my academic capability. But I also did like tennis, and I love tennis as a sport, and I did that throughout all of that. And so I integrated that in my personal statement, and, showing that passion there, showing that you have like, a personality, I think it makes you stand out more as a candidate. So in addition to that, I did scribing as well. So it's just a delicate balance, things that you can talk about in depth. I think that shows you more as like a overall, like, as a whole, as a person, passionate person. So
I guess I can add to what Jeff was saying. For me, I took many gap years. So I took a total of 5 gap years. And so during that time is really when I did all my extracurriculars. While I was in undergrad, I was working like almost full time. So I didn't really have a lot of time for clubs or, a lot of things people do in undergrad. So during my gap years, I worked a lot in clinics. So I was a medical assistant for several years. And mainly, it's something that really excited me. Just talking to patients and being in a clinical setting was something that I enjoyed doing, but at the same time, it was something that I had to do to like make ends meet. So I guess going back to like what Jeff was saying, it's really important to like bridge together the things that make you happy, the things that you're passionate about, without trying to fit into this mold of like, what does the admission committee want to see of me as an applicant? When I applied to medical school, I didn't have like research at all. So that was something that I was really like nervous about, but it definitely wasn't anything that is like negative if you don't have that coming in.
So I'm pretty biased because I was a scribe, but and we've mentioned it multiple times, and it's not like it's a necessary thing, but I just to like recommunicate. There's great exposure in scribing, and you can work alongside doctors and try to pick their brain and try to think the way that they're thinking in order to write the best notes. And I think it's a great way to get exposure to the healthcare field, give you like a head start when you start medical school. Also, the HEAL clinic that it's been mentioned in the chat multiple times, stands for Health, Education, and Learning. It's a great mobile clinic that targets underserved populations in the San Joaquin Valley. and it's led by Dr. Bond. And yeah, it's a great program to get involved with. So I would feel like the two main things that I would probably suggest to like undergrad students would be, if you can, try to find a scribing position, and also get involved with the Heal Clinic. Those are two really awesome things. Also, kind of like a side note on this, I was really involved in just like working out and or playing sports and stuff, which seems not related, but going along with Jeffrey and Vanessa, what they were saying, just like doing what you're passionate about. So those sports and working out in general are kind of like my passion. And you should definitely mention those things in your application. So there's like an activity section. And so I definitely mentioned those in my amongst my activities. And it actually sparks a lot of discussions in interviews or things like that. And it's like, people like to see that. So yeah, do what you're interested in. As long as you're getting out and doing stuff. It doesn't even necessarily have to be medical related, but if you're staying active, typically that's just a good thing to do, and make sure you mention that.
I wanted to quickly just mention that I did not enter medical school with any direct patient contact. So it is totally possible to go into medical school not being a scribe, not shadowing a physician. And I really want to echo everybody's recommendation in terms of like, you want to do something that you're passionate about. For me, what I'm extremely passionate about is public health. How does health permeate in spaces outside of the clinic and the hospital? And so I was really involved in health promotion. I was really involved working with community partners. So for me, you want to really think about what are the reasons why you want to pursue medicine. And yes, while it will be helpful to see that interaction between, you know, patient and a doctor, and just kind of understand like how the inner workings of like the healthcare system works, I think that is that's probably something that I could have used, that could have helped me. But you're going to learn that stuff anyways when you're in medical school. So I think the biggest thing that medical schools are really looking at is, what is your why? And do those experiences really make sense into the doctor that you say you're going to be? I think that's the critical aspect of it. So like, for example, when during my gap years and in undergrad, I was really involved in organizations like CHE, which is like the Latinx, health promotion club. I also was doing work as health education. I also was involved in like health leadership, health population health initiatives, all that type of stuff. So I see myself as a doctor still working at the health leadership level, and I still see myself still integrating public health ideologies and initiatives to be able to think about not how to just take care of the patient when I see them in my exam room, but also how do I take care of the patient when they're out and about in the community. So I think the biggest thing for you is think about, okay, well, what really is my why? You know, and when I talk to students, I usually have them to think about, okay, well, what motivates you? You know, are you really interested in, like, what is the health issue that you're interested in? Is it, you know, women's health? Is it, you know, pediatric health? You know, so you want to think about it in that regard. And then from there, think about, okay, what's the population in which I want to serve? Is it, you know, undocumented immigrants? Is it the Black community? So once you kind of narrow that down, then think about community partners in which they're the ones that are serving the population. I am really big in not reinventing the wheel. There's a lot of rad groups within the Fresno and the greater Central Valley that are trying to do this work. So, you know, as physicians or clinicians, we need to really partner with our community allies who are doing this work better than what we can do, and really try to ask them, how can we support you? And in that same vein, unfortunately, we have probably a lot of great resources and community organizations that are not doing that work. So that's a great opportunity for you to identify that gap and try to think about, okay, how can we really serve this community in the best way possible? So I guess what I'm trying to say is that, you know, you don't have to be in the patient exam room. You don't have to get clinical experience, you know, in a hospital or clinic. but really think about, okay, who's the people that I want to serve? What's the health disease or condition of interest that I think I see myself doing? Put that as your extracurricular activities of focus, because that's going to really make sense when you apply, and hopefully that will continue your development as you go through medical school and as you go through residency and practice. So I made it into medical school without any clinical experience, and doing just fine.
That is such great info. And I think it kind of leads a little bit into the next question, asking the panel about what challenges did you experience applying to med school that you wish you would have known before?
I can speak a little bit on this one. One thing that was really challenging for me was cost. I didn't realize like how much it would cost to apply to medical school. It's different for everybody. There is a fee assistance program or waiver that you can apply for through AAMC, and that will give you, I think it's about 15 applications that you don't have, like a waiver for 15 applications that you don't have to pay for, and that is super helpful. And especially when you get secondary applications, if you send an email to those schools and say, hi, I qualified for the FAP, can I please waive my secondary fee? A lot of those schools will also waive the fee of secondaries, because applying for primary school applications to medical school, it's about, I think it's like a fee of $140 or something for the first one, and then each additional one is about $40. And that's just for the first application. And most people apply from about 25 to 35 schools. And so that cost adds up. And then when you get secondaries, each of those can range from like $80 to, I even had one that was $130 just for the secondary. And so when it's very competitive to get into medical school. And so we tend to want to apply to more, because more is better than less in this case. And if I would have known how much money it was going to cost, because I didn't really have anyone to guide me or mentor me in it. It was kind of through friends or through just me researching it on my own, that I kind of just had to figure it out. But it's definitely take time to save money for applying, and knowing that it's cost quite a bit. And then like something I used to help pay for my med school or to pay for med school applications was, I had qualified for credit cards earlier on in my like journey in undergrad. And this is not what I'm recommending, but I just ended up putting all of it on credit cards and just like hoped that I'd be able to pay them off eventually. And it's worked out. I'm a firm believer that if you really have a goal and you really want something, I always believe that I don't want anything to get in my way. So I believed in giving my 100% into one application cycle and just putting in the money I needed to put in, and only doing it and trying to only do it one time, because it just is so costly to do it, to keep applying over and over.
I think to echo a little bit about what Ray said, I wish I would have known that when you apply to med school, you really want to put your best application together before you apply. I feel like after I graduated from college, I was just really eager to get there and to get to that point. So I kind of applied a little bit blindly. And it wasn't until like my third application that I actually kind of addressed a lot of the things that were a little bit questionable on my application, like my MCAT score, my GPA. Those are all things that, they were low, and I was still very much applying with that. So I think I wish I would have just known that if it takes a little bit longer to address those things, like it's okay, and just kind of going in with that mentality, so that when you do spend all this money and all this time, it's, putting your best foot forward and not like application that doesn't like accurately represent what you're capable of.
Anybody else on challenges that you wish you had known? Okay, if not, we will go ahead and move on to the next one. The next one's a little bit more upbeat. What has been the most rewarding part of your medical journey thus far?
You mind repeating that question? Sorry.
Absolutely. What has been the most rewarding part of your medical journey thus far?
I can go ahead and start with that. So for me, it's honestly has been being part of SJV Prime. Medical school is medical school, and I've heard that time and time again. And I was pre-med in undergrad, never applied. It took probably close to almost 10 years to finally put an application forward. And so for me, I've always heard about people saying medical school is so hard, but all that matters is you get that MD degree. And so as I kind of went through life and thought about, okay, I'm going to be doing this in my 30s, I really want to resonate. I really wanted to have my why really resonate with me in terms of okay, if you're going to do this hard work, you really want to make sure that you're not going to doubt yourself as much as you probably would. I may still do that, but every day as being part of SJV Prime, I'm constantly reminded this is why I'm here. This is why I made that sacrifice. So for me, that has been something that's been very rewarding. Like I said, I'm being surrounded by classmates that are just as motivated and passionate to do the work that we need to do. And I will say in the immediate, being a third year at UCSF Fresno has been the most rewarding part of this whole entire experience. So I know all my classmates who are currently at main campus that are about to come, this is going to be one of the most rewarding parts, but it's also one of the most scariest parts too, because you now have patient lives at your hands and you're still learning, how to apply all that book work knowledge into practice. So yeah, the most rewarding part is being part of SJV Prime, meeting the amazing people that are just as motivated and passionate to do the work that we need to do, and being here at UCSF Fresno as a third year medical student.
Yeah, so to Jackie's point, I have to echo that. I think the most rewarding part of it is being able to be down here. I've had my struggles throughout medical school, and it's hard the first 2 years and you self-doubt yourself, but when you get down here and you start doing rotations, I think the part that has really stuck with me is being part of that, being integrated in the patient care and really seeing the struggles that people go through and being part of that change. I think that overall, getting into the patient care is what we, why we went into med, why we, strive to go to become physicians overall, and getting to be part of that team, really being integrated as part of that surgical or OB-GYN team that we've gone through so far has been the most rewarding overall, because you get to see that outcome, when someone is really hurting from whatever they have, be it an inguinal hernia and then, or a ventral hernia that I had, I participated in. She was really hurting. We had this patient maybe 2 weeks back, and she had a tracheostomy tube, couldn't talk, had this intractable or just vomiting every day and pain every day. And then the next day after we saw her rounding, she was just all better, and she was much happier than she was and really grateful. So to be part of that was really great. So I think for everybody that has those doubts, when they go through this journey, just understand that that part is still there. I mean, just look forward to that. So yeah.
I really appreciate what Jeffrey and Jackie have just said, because as a second year medical student at UCSF, we have not yet started clinicals. We'll start that in January, and definitely with COVID and everything that's going on, it's almost like you can lose sight of why you're doing this, because all we're doing right now is book work and just learning diseases and how to treat different diseases, and but just hearing how impactful it has been being in Fresno and starting those rotations, I think is awesome, and really actually even helped me right now just hearing y'all talk about your experiences. So thank you for that. I would say a rewarding thing for me so far, with the little clinical experience that I've had so far, is through the SJV PRIME program. We have something called, well, all of UCSF Med School does ARCH weeks, but through the SJV PRIME program, we did the first few ARCH weeks in Fresno until COVID happened. And one of the opportunities that we got going to Fresno during those weeks was to do the mobile heal clinic that a lot of people have mentioned in the chat. And that was really rewarding because we get to work with patients, but also we get to work with undergraduates from like UC Merced and Fresno State. And we get to work with physicians, attendings and residents. And most of all, it was really, whenever I did the mobile clinic, we went to a shelter in Fresno for people experiencing homelessness. And we provided some, screenings and different care to people there. And, those, for some of them, it was like the first time that they had seen a doctor in like years. And, just being able to be there for them and connect with them and just get that little clinical experience that we've had so far was really, really rewarding. And, there's a lot of people experiencing inequities when it comes to healthcare in the Valley, and seeing that is heartbreaking, and just further shows me like how much I want to return to the Valley and as a physician and serve my communities.
Excellent. Anybody else would like to tackle that question, or would you like to move on? Okay, no one else is jumping at it, so we'll go ahead and go to the next question. For those of you that did a non-traditional route, can you briefly describe the advantages and the disadvantages and how you used your non-traditional experience in your applications?
So I guess I can start with this non-traditional route. So, I mean, I guess a timeline of everything. I'm the first person to go in my family to college. So I had no one to tell me what the route would be, So I did my undergrad at San Diego State, and then I took like a little bit of an informal post-bac at CSUB while I studied for the MCAT. And then while there, someone talked to me about like doing chemistry work. I have a degree in biology, and so someone approached me with about environmental chemistry. So I jumped on it because as a student, you don't really have a lot of debt afterwards. No one really tells you about that. But I did 4 years of like chemistry work. I worked on a bench with this thing called a gas chromatograph, where I basically analyzed dirt for whether or not there was petroleum in it. And that was it took a little bit, but after realizing like that wasn't my life that I wanted to have for the rest of my life, I decided to go and apply for a post-bac at UC Davis. Got in, thankfully, and then that's when it like all kind of fell in, when that post-bac led to more experiences in getting exposure to the medical field. It kind of reinvigorated that passion. It's like, this is for me. I need to be around people. I need to be able to be able to talk to not just dirt samples. And I think that I needed that motivation, or that like reinforcement with the post-bac, to realize that that medicine is a career path, because no one in my family, like I said, has gone past high school, and so no one really gave you like the idea of or the tool sets or the tool to go forward. They just were proud of you going forward. But so getting that reinvigoration from the post-bac and getting that confidence from them, I decided then to apply afterwards. And I had my struggles with the MCAT as well. I took it once prior and I got an okay score, but then the second time around, I had to postpone it a little bit more, just because I wasn't fully ready. So the time that it took from when I graduated in 2010 from undergrad, and then finally entering like 7 or 8 years later, that was a long time in between. I think what it gave me was perspective overall. It gave me the confidence to know that, like, you know, I experienced this outside the life outside of medicine, and it made me be more thankful for the fact that I'm here now as a medical student. It reinforced the ideals of, like, you know, that becoming a physician was really the only path for me. And then it just made me more thankful for, like, being here overall. And then it gives you a little bit of this more, I don't want to say, you know, my colleagues are immature, but like, it gives you more appreciation, you know, for the career for medicine, I think. Yeah.
Could we repeat the question? I wanted to answer.
Absolutely, yes. The question was, for those of you that had a non-traditional route, could you briefly describe the advantages and the disadvantages and how you used that experience in your applications?
Yeah, absolutely. So I can talk about this a little bit because my route was kind of like pretty non-traditional as well. As I mentioned, when I was in undergrad, I had to work to like make ends meet and pay for college. So I didn't have a lot of the things that I needed to apply to medical school. And I kind of realized that I wanted to go into medical school like my senior year. So it was already kind of late to do the traditional route. So for me, it took a lot of like, it took a lot of time to really figure out, you know, how do you apply to med school? How do you study for the MCAT? Like all those intricacies that go into this process. It took me a while to kind of get to that point. But I think in terms of the like disadvantages and advantages, I think it depends at what point of my life you're asking, because now looking back, it's all advantages, but I think back then it seemed really like a big disadvantage because I just compared myself to all of my colleagues that were, you know, second years and third years in medical school, and I was still like working as a medical assistant. So for me, it was really hard because I always just thought like, I want to be like them. Like I already want to be in school. But looking back on it now and kind of like referring to what Jeff said too, is I think it gave me a broader perspective about not only like it really solidified my desire to want to be a doctor, but it also helped me understand like what kind of doctor I want to be. And during those gap years, I think I really grew like as a person and as an applicant. So I think looking back at it now, it was all advantageous because I was able to use the experiences that I had during those gap years, not only like working in clinics, but also just in life, to really talk about like how I grew as a person. So I think that it's important to look at like that non-traditional route in terms of, you know, what are the things you learned from those experiences and really honing in on that when you apply to medical school, because, you know, it's hard to explain, but in the application process, a lot of it is really difficult because at least for me, like I was a little bit vulnerable in the things that I talked about, but I think in a sense, it helped me really tell my story a little bit better. So I think that was really important as a non-traditional applicant.
I want to also chime in regards to my experience. So I would have to agree as well to what Vanessa said. You know, I think everything that I've experienced before matriculating into medical school were advantages, even though maybe at the time they didn't feel like it. So just really quickly, so I spent 5 years in undergrad. I graduated 2009, and during that time, I had chosen to study public health. I fell in love with the field. I felt like it made a lot of sense in the spaces in which we eat, sleep, work, and play and pray really influence health, not necessarily what happens in the context of a hospital or a clinic space. So for me, I really jived with that, and I really just wanted to be immersed into it. So as I mentioned earlier before, I kind of had this notion of what a doctor would be, but never really interfaced with the healthcare field. So I just myself wasn't comfortable making a full commitment to medical school and being a doctor. To a lot of students who I speak to, I always compare it to going to medical school, being a doctor is like getting married. Once you make that commitment, you're in it for the long run. And I wasn't I wasn't ready for that, for me personally. And so what I wanted to do during that time was to really exhaust the career opportunities that public health had to offer. So what I did immediately afterwards is I stayed in the Bay Area and I worked in a FQHC, and I ended up doing a lot of the amazing work that I was doing as an undergrad student, working in health promotion as part of the Latinx, Chicana health education. I think they're called CHE and health education. Yeah. So I was doing that, you know, I was in charge of the, you know, health education, you know, applying for programs and doing all those amazing things. And it was funny because that was my first time really seeing like how a clinic works and, you know, what part a physician has, which is not all of it. And so I really enjoyed that aspect of it. It really opened my eyes. And to be honest, I had waves during this whole part of working in the healthcare space, even later in my life, where I was just like, you know what, I'm not going to do medicine. It just doesn't make sense to me. And so I would have these waves of like, okay, I'm going to do medical school. Nope, I'm not going to do medical school. And I think it wasn't until I worked there for about 3 years where I was like, okay, you know what, I'm ready to re-engage in this dream of being a doctor. During that time, I think I was going to 4 or 5 years out, and I had reached out to a pre-med advisor of mine who was pivotal in terms of my pre-med journey and undergrad. And he was like, Jackie, everything looks great. You have the upward trend. You know, you're getting some really great experience, but you've been out of school for quite some time. And this was the beginning of, so when I graduated, like I said, back in 2009, the whole like post-bac, non-traditional route was starting to get it was starting to gain in popularity. So yeah, now like, you know, almost everybody does a gap year or, you know, is I feel like non-traditional is the new traditional. So at that time, he had told me, you know, you've been out of school for quite some time. Medical school the medical school admissions committee are going to really question what your capacity of being able to survive in those classes are going to be. So that was like the worst thing you could have told me, because I was like, oh my gosh, like I don't want to go to school again before like going into medical school. But I really trusted him. And so I ended up doing the UC Davis post-bac program 2013-14. And so, you know, I got to re-engage in all of those like pre-med classes, upper division science classes, which I hadn't done in about a couple of years. And then it was during that time that I decided to pursue a master's in public health. Again, I'm the type of person that like, you know, I really analyze my decisions really extensively. And so I made the decision to pursue a master's in public health because, again, I just really wanted to make sure, even though I was in the post-bac program to gear you towards becoming a doctor, I really wanted to make sure, okay, did I really exhaust public health to the fullest? And so I went to get my master's in public health at UCLA. And then when I graduated, I returned back to the Valley due to a family unexpected death. So, you know, I came back home to earn some money. And it was then that I, you know, was working in the hospital, just reignited that passion for being a doctor. So that's when I applied. I think what I'm trying to say here in my journey is that everything that I experienced, you know, being in the healthcare field and being a public health practitioner really informed and really solidified my why into medicine. So that way, when by the time you apply, your activities do not look like they're just check off the box type of activities. Like when you apply, you want to be so certain and stand behind everything that you do. And so I would say those are the most successful applicants. And those are what I try to tell my students or my mentees is that like you want to have a theme and you want to make sure that that permeates through and through everything that you do. So when I applied, it was very, very clear that my mission statement of what Jackie wants to be or wants to do as a physician is to continue that work. And so I would say that being a non-traditional student, for me, it just took some time to really kind of understand that. But as you hear me talk, I am very, very comfortable in what I, you know, come to you and come to my patient as, and I'm very, very comfortable in terms of what I hope my career will be in medicine. So definitely a lot of advantages. I spoke very confidently, very secure about what I want to do in medicine in my interviews, and I believe that's what allowed me to get into medical school, is because I came in with a vision, and I also continue medical school with a vision, and I hope to continue my practice in medical school with that same mission of just, you know, hoping that the Central Valley can be one of the best regions for our state.
Thank you so much for that, Jacqueline. And you actually, because of what you touched on, it kind of leads into our very next question, which is about post-bac programs. So for those of you that did a post-bac, what do you recommend for students considering this? And what is a post-bac good for? And when should you consider doing a post-bac program? Kind of a lot of questions in there, but just basically, what's the benefits of a post-bac program, and how can when should you consider one?
I can talk a little bit about the post-bac program. So I actually went to the UCSF post-bac program in 2018 to 2019. So I took a total of 5 gap years. And so that post-bac program was my final gap year. So right before I applied to medical school. In terms of timing, I would say to maybe do it closer to when you're going to apply, because a lot of post-bac programs will also prepare you to take the MCAT. And so you'll kind of want to do that, you know, the year before you apply to medical school. And traditionally, some students will take like a gap year off after if they need to, but others won't. A lot of my classmates in the program applied right after we finished. And so now we're first years. But there are so many benefits to a post-bac. I think if you are, you know, in college and you're doing okay, it's not really something that's necessary. But if you're one of the students that, you know, really struggled in undergrad, I know I really struggled in undergrad and my GPA was very low. Just for perspective, I graduated with a 3.0 GPA. And so looking at, you know, applications for medical school, that didn't seem like a very competitive number. And so on top of that, I needed help with MCAT prep and really drafting my application to make it a really like a strong application. So for me, doing a post-bac was a way to kind of address all of those things that I needed help with. So one of the benefits is that you kind of have a lot of mentorship and a group of individuals that are, you know, their sole purpose is to help you get into medical school. So it's like a really well-rounded way to get you to that point. And as Jackie, I think, mentioned earlier, is that if you've, you know, been out of school for a long time, or if you didn't have good academic performance in undergrad, it's a really good way to demonstrate that you are academically competitive for medical school. So the whole goal is really to do really well in that post-bac program and hopefully, you know, get a 4.0 so that you show like, look, I can handle medical school, I can handle the classes, and I'm going to be fine. That's really the goal there. But definitely highly recommend post-bac programs for anybody that you know, kind of fits into that mold.
So I completely agree with Vanessa in terms of just the post-bac. I mean, that's what, so definitely do a post-bac if you have a little bit of a, you know, some holes in, say, your undergrad career. I definitely fell into more of what Jackie's category in terms of just like being out for a while. I'd been out for maybe 4 years, and so to demonstrate your academic competitiveness or just your ability to do well in the setting of med school, the post-bac is definitely like a great thing to go into. And so I guess a friend had mentioned the post-bac, and at this time when I was after my informal post-bac, which was just like, I was just taking classes at like near my hometown. I was studying for the MCAT, and then I had gone in to become a chemist. So at this point I was just like, wasn't really super sure about like my career in medicine, but a friend had told me about this post-bac and I had applied, and you know, I just was trying to see whether or not the medicine was for me. And so I think to Vanessa's point about the mentorship and surrounding yourself around people who are like-minded and who are very passionate, that was the case at UC Davis. And to have that positivity and just that drive surround you, it's infectious. And so I think overall the post-bac was what you know, I guess in chemical terms, just the activation energy pushed me over to the other side. I think having that along with like that structure there in a formal post-bac was what really did it for me in terms of getting into med school. They gave you like kind of a structure while you're in it to get that 4.0 or to get that really high GPA, along with, you know, the next steps in, you know, applying to medicine, to, you know, using AMCAS and all that stuff. Because if you haven't done it yet, I mean, that's, you don't, it's a whole new, it's a different thing than applying to undergrad. But also the resources that they give you in terms of just like preparing for the MCAT. For our program, Jack and I went to the same UC Davis post-bac, but we use Kaplan as a MCAT preparation program. And so they gave that as a resource afterwards, and kind of gave us that mentorship and gave us that like intermittent or like periodic exposure to the medical field to like kind of reinvigorate you. We often go for like on Fridays, go to the medical school and, you know, hear panelists that are, you know, like us medical students talk about like their stories, and then that would make you, just charge you up to keep going forward. So I think that that's one thing that the post-bac did for me, was just like it reinforced that medicine was for me, and then also gave me a structure to move forward and get into med school.
I wanted to clarify something from some questions in the chat. A student asked about like, what if you didn't get a 4.0 in your post-bac? And I don't want, you know, students to feel discouraged if you didn't get a 4.0 in the post-bac. That's not the, you know, that's not the, it's the goal, but that's not like the end of the world if you didn't. I think the overall idea is that you want to show an upward trajectory in your GPA. So whatever that means for you, then that shows improvement. So by no means should you feel that if you didn't get a 4.0 that, you know, you're not eligible for medical school. It's not the point. As long as you are improving from what you did in undergrad, then you are in a totally great position to apply.
I wanted to chime in real quickly and just kind of offer some advice when it comes to the post-bac program. I think Jeff and Vanessa did a really good job in terms of the post-bac experience. And for those of you who are thinking about applying to the post-bac, one of the biggest things that I tell students is you want to do the post-bac when you're ready. So what I mean by that is you want to ensure that this is going to be the focal point of the next year or two. So what I mean by that is, you know, a lot of us are human beings and we are integrated in various different spaces, such as, you know, you're probably a sibling, you are a son or daughter, you're probably in a committed relationship, finances, like there are so many things that are happening, you know, at any given moment. You want to be honest with yourself and ask yourself, is this next year or two the best time for me to do this? Because post-bacs are truly your last second chance to prove to medical school that you can handle the work. So that's number one. And I know that for all of us pre-meds, we like to plan a lot and we like to try to follow through with those plans. Okay, this year I'm going to do this, and this year I'm going to do that, and then I'm going to do MCAT, and then I'm going to apply. But then life happens, you know, and it still does happen even when you are going through the cycle, when you're applying or doing the MCAT, and when you're in medical school. That has surely happened to me. So I think that's number one, is really be honest with yourself and say, is this next couple of months, you know, however long your post-bac needs to be, am I honestly going to be able to give it my 110%? Because whatever grades that you get, that is what you're going to put forward to medical school. And I agree with Vanessa. You do not need to get a 4.0. I got 1B during the post-bac program and I still got in. But you do not, I would say you do not want to apply to medical school and get a GPA less than a 3.5 or even a 3.7. So that's what I'm saying, you know, like I don't want you guys to go through the post-bac program and not be able to show your full selves. You know what I mean? Again, this is your last second chance to approve to admissions committee that you can handle the work. Number two, and this is something that I was caught by surprise by, because again, I was told by my undergraduate advisor that you need to do post-bac. So I never really saw that as part of my plans. So I just kind of did it in a whim. But the post-bac program is expensive. And I know a lot of us are very sensitive to loans. When you do the post-bac program, you actually will have to tap into private loans. So, you know, you have to think about what is your financial circumstance with credit. Can your family, do you even have the opportunity or the privilege to be able to put people as co-signers? So what I tell students about the realities of the post-bac is that, you know, if I would have been able to do it again, I would have saved money to be able to not accrue as much debt as I would have. So when I talk to students who need like some type of work experience, you know, to improve their application to medical school, I say let's try to double dip, triple dip. You know, let's get you a job as like a research coordinator, you know, so that you can build up your research bucket, and then also too, you know, not trying to accrue so much debt. Or if you need clinical experience or community service experience, let's double dip and have you get that as a job, save money. So that way, by the time you go into the post-bac, you're not having to, you know, accrue as much debt before you go into the debt of medical school. So I think that's the biggest things that I would say. And I wish people would have told me, and we don't really think about this when we're trying to do the post-bac, is, you know, really think about, you know, have an honest analysis of yourself in terms of your time of your life when you're going to do it. Where's the location going to be? So that's another one too that I heard as well. If you can't do your post-bac at home because everybody in your life is, you know, in the city of Fresno, maybe you need to think about changing your program, you know, where you do it, or maybe you need to live out of the house for a little bit. Again, this is all kind of going into the finances. I would say think about those aspects of what will make you successful to the post-bac.
Thank you so much. Well, once again, Jacqueline, you kind of marched right into the next question, which is actually our final question of the panel, asking the panelists of the predetermined questions, and then I will hand it off to my coworker, and she will lead the Q&A questions that we might have additional ones coming in. So the last one is just for all of you on the panel, just what parting advice do you have for pre-med students? So Jacqueline, you kind of touched on it briefly as you were giving advice there. So if there's any last parting words you'd like to share as well, but what parting advice do you have for pre-med students?
I could just really quickly say, and this is extremely, extremely important, no matter what phase of the pre-med path that you're in, is know your why. This is a long road. It is a hard one. If you can tap into that as a pre-med, ensure all your extracurricular activities are in line with that. Ensure that you find programs out there, medical schools, programs such as SJV PRIME that can really tap into your why. When you have those moments in medical school where you're just like, why in the frickin' F am I doing this? You know, I think kind of like what Ray talked about, this, it happened to myself and my other colleagues who, you know, already went through the first 2 years of medical school. It is really easy to get lost out of touch with that. So, you know, really know your why in terms of why you're doing this. And it will make you successful and break through those moments of challenge, because I promise you they will not go away. They will just make you a stronger person. So my last bit of advice for you all is your why, your why, your why. And I'm hoping that SJV PRIME will be one of those whys for you.
Thank you so much for sharing that, Jackie. I totally agree 100%. The why is super important, especially if you're a non-traditional student like many of us. Like, there's going to be so many times that you're questioning, you know, why this is taking so long and why you're doing it. So definitely important to keep that in mind. I think just to add to what Jackie was saying, I think it's really important to look at your journey as a, you know, as not really comparing it to other students. I think it's really important to acknowledge the fact that everybody's journey is really unique, and you know, my journey is going to be different from your journey, and your neighbor's journey. It's all going to be different. So don't try to compare yourself to people and think that because you don't fit their mold that you're not going to be, you know, a competitive applicant for medical school. Really look at different things that you might consider to be, you know, negative aspects of your application and really turn them into strengths. So really use any challenges you have faced or you might face in the future, and talk about those, really be vulnerable and address those and talk about how you grew as a person and how they will make you a better future doctor. I think that's really important moving forward.
Yeah, I definitely agree with Vanessa in terms of just the, you know, having a good perspective of your entire route towards medicine, towards medical school is something that you always have to like keep in perspective. I think that my advice is just to be kind to yourself. Oftentimes as pre-meds, you get really down on yourself. You really you look at everything that you've done and you kind of like, you know, I've had my struggles. It's in academics, and I get down about like a certain grade or a certain, you know, my path. Like I should have done this, I should have done that. Understand that like that's done. That what's done is in the past. It's going to stay there. But having that like clear path, being very, very sure about like your route to medicine, as Jackie has said, know your why and going and know that like going forward it's going to be a difficult route. Having that trajectory and forgiving yourself for whatever happened and having that determination to do really well in whatever is next for you is really important to demonstrate both your passion and also like your capabilities as a future clinician, as a future medical student, right? And appreciate where you're at overall. Like you went through those struggles and you've learned something from it. I think that overall that in and of itself makes you more grateful and will, you know, like unburden kind of the struggles that you've gone through, and then allows you to go, you know, move forward like easier. I think that like I've encountered my struggles in med school, and not having that burden, like not picking yourself as this individual, like I messed up in this way, allows you to like just be a better student. Or, like you'll get there eventually. Just like I think Vanessa had said, you know, comparing yourself to others, you may not be the same student. It may take you longer, but it's okay. You'll get there. I think that a lot of the mentors and a lot of the clinicians or doctors that I've worked with, I've shared with certain struggles, and you know, it may take longer, but you'll get there eventually. I think that's what some of the doctors have said to me directly, was like certain residents or medical students, they start at different levels, but eventually when you get to that program, they eventually just meet at the same point. They get to where they need to be. So forgive yourself for whatever you're at, and understand that like everybody's different, but just keep working towards it, and you know, and keep striving. I think that's really important, to like not get down and second guess yourself. Just like have that determination and be proud of where you're at so far, you know, and then just like keep that drive.
Yeah, I agree with everything that my peers on the panel have said so far. The only thing I would add that has really helped me, just like throughout undergrad and even med school in general, is being comfortable with being uncomfortable. I feel like that, and for some of you who may have heard me as a panelist before has probably heard me say that, but that is like to this day still like what I live by, because I think your growth, like the growth that you experience in yourself, comes from situations where you're uncomfortable. And, you know, whether that's like if you get offered to, you know, give a presentation or to do this job or to, you know, just do pretty much anything, if the moment that you feel like a little unsure of yourself and you feel like you might not be good enough to do it, that's the moment that you should take it. You should fully immerse yourself in that, because being uncomfortable can hold us back, but those feelings are areas that we need to grow in. And so just like my biggest advice is always, anytime you feel uncomfortable with having to give a presentation or having to participate in something, I say just go for it, because you'll get growth opportunities through that.
Anybody else? Nope. I think that pretty much wraps it up in regards to our predetermined questions that we had for the panel session. So I would just like to personally thank all of you for sharing your own personal journeys and providing such great insight and advice for our participants. I would like to now hand it over to my co-facilitator, Miss Karina Benanuelos, and she is going to just read out a couple of questions that we may still have in the Q&A session to get those answered. So thank you very much. And Miss Karina, I'm going to hand it off to you now.
Thank you, Paula. Thank you, panelists. So far, we've had quite a lot of questions that thank you for all being attentive to those. But here are some that we have that we would like for you to answer for our guest. Here it is. I would like to bring more clubs who help underrepresented minority students to my campus. Do you have any advice or words of wisdom on how I can go about doing this now that everything is being carried out on Zoom?
You know, that's like a really good question, and having things over Zoom makes it really difficult to do a lot of things. But one thing you need is a point of contact to reach all the people you want to reach. So I think that is like the number one thing you need to start a club, is just like, what is your mission for that club? What organizations in your community are doing similar work to what your mission is, and kind of like talking to those organizations in your community. And then also, like, through your school, how can you reach people? You know, like, is there like a group on campus or like a service on campus provided to students that they have like a list of people that they can email with asking for interest? Do you have like a Facebook page for your class, or do you have like, is there a school website where you can, you know, just like post announcements or post opportunities to get involved in things? I feel like you kind of have to put all those things in place in order to do something over Zoom, because you can't just put flyers for people to walk by and see. So I think there may still be some in-person stuff on campus when it comes to like science classes and labs. So maybe posting some flyers around those areas could be useful, but definitely your mission, reaching community organizations that are doing similar work to what you're interested in, and having a point of contact for being able to reach out to people.
Wonderful. Thank you so much. All right, we have one more question. What about taking prerequisites at a community college versus a post-bac? And this person is a non-science major.
So I'm gonna say something that was told to me. Unfortunately, it's pretty discouraged from what I've been told. I think community college is okay if you're trying to do like 1 or 2 outstanding prereqs. So like, for example, I know quite a few other of my friends, we finished out like the last semester of physics at a community college. So that's not necessary. I would say like 1 or 2 data points for a school to look at that is not going to really significantly deter your application. However, if you do feel like the post-bac is what's going to inform medical school admissions, that you can do this work, I have been told, and I would recommend myself as well, that I would say at least at the CSU level is appropriate post-bac classes. which I know goes into the concerns of finances and everything like that, which is why I was talking about in the very beginning. If the post-bac program is part of your journey to enter to medical school, really think about critically, is this the good time for you to apply or to engage in a post-bac program? Because that's the only thing that you should be doing. No working, no, any extra things. Also, too, it's expensive. So again, if you have 1 or 2 classes left, that I don't think that's going to be too much of a difference, but I would say at the least at the CSU level, if you have more than that, to be considered seriously for medical school admissions.
Just to add my 2 cents. I went to community college for 3 years before transferring, actually, and I did a good amount of my prerequisites at community college, including a whole year of the general chemistry, a whole year of the organic chemistry, and some of the physics, and I did very well in those sections, like on MCAT and stuff. So I think in general, I think community colleges are underrated. They're way cheap. The class sizes are much smaller. A lot of the times the community colleges use the same books that like the nearest university would use. So if you put in equal effort, you can actually, I feel you can get a great education, if not better in certain cases, at community colleges. Like for me, my cousins, I've actually had conversations about my cousins recommending them to go to community college first. And that's how big of an advocate of community colleges I am. And so definitely don't shy away from a community college. And you're definitely going to save money from that. And you're going to have a smaller class size. Don't hesitate for asking questions. It's much easier to ask questions. Community colleges, much smaller class sizes. So I can't speak for post-bacs, but in general, community college, yeah. If you want to do it, do it.
Can I just say something here? This is Dr. Alving. I agree with what Jacob has said. I think that, we have many students who do community college first. And I think nobody should be dissuaded from that. I saw there was a question in the questions about that. Also addressing the question that Jackie was answering about whether or not, once you've completed a 4-year degree and are ready to go to medical school, whether or not it's acceptable to do the required pre-med courses at a junior college, community college, or if you have a lot of them to do, or do you really need to go and do a post-bac? I think, I personally don't even know the answer to that question. I know Jackie has heard, but I think that is a good question to ask our admissions officer this afternoon, who will be doing a session. She would be able to really give the nuances about that, because UCSF does have a very holistic applications process. And if somebody doesn't have a lot of money and they did the junior community college because of that, it may or may not disadvantage their application. And I wouldn't want to say that it would without her really weighing in there, because I think the financial burden of doing a post-bac can be very great. And there may be people who won't be able to do it. And UCSF is really dedicated to not disadvantaging people. So I think that would be a really good question to ask her. So.
Great. Thank you all so much for answering our Q&A questions and that our attendees had. I am going to now pass it over to Dr. Phillips.
All right, thank you everybody. I just want to thank our panelists one more time for your very insightful stories, sharing your journey to get to where you are. A lot of different paths have been taken, and all of them have gotten you to really the same place, which is in medical school. I think what's really important for our participants to hear is that, like somebody had said earlier, no two paths will look alike, no journey will look alike. It's about you really knowing yourself and owning your why. So thank you so much for that. We are